quicker. And so obviously today we're going to talk about what that title says right there, optimizing performance through the nervous system. And that's all chiropractic is just training the body, putting better movement into it so we can live healthier and active lives. So
Yeah, break down
yeah.
slower, wear and tear.
So I don't know how if I can. Oh, there we go. All right. So professional athletes, we talk about this all the time in the office, how much they utilize it versus the general population. Um, and yes, they're on TV, they're making the big bucks, they're utilizing it way more than we as the general population are because they know that in order to stay at the top of their game, their body has to perform at its peak. They have to have good recovery. They have to have good mobility. They have to have good strength. And chiropractic, we'll dive a little bit into the neurology. Today, we've talked about it previously, just how beneficial it is, how much it up regulates the whole body to perform better, to engage the muscles better. Um, and so, yes, the athletes have to be able to perform at their peak. That's why they utilize it. That's why every major sports organization now has it. For a while there, um, every NFL team, all 32 teams have a chiropractor on staff. All MLB teams have a chiropractor on staff. You see, there's I think it was during, was it last week's PGA
Yeah,
golf
we
tournament?
adjust them on the
He
golf course.
adjusted him on the course, and so you
Yeah.
have professional golfers whose chiropractors are uh, uh, walking with them on the course and getting adjusted on the course. And so it wasn't until I think in the last 2 years that every NBA team actually started bringing chiropractors on. There was only one team that didn't. It was my Detroit Pistons. Because the head physical therapist for the team said absolutely not. Like, I will not work with any chiropractors. And I think he's since retired, and so they have a new
Or moved on at some
moved
point.
on.
Yes.
And they now had to double check, but they now incorporate and have a chiropractor on staff too. So
Well, and I'll add this, right? So when you think about it, right, back in the day when, when I was growing up too, the chiropractors, you had certain athletes that had chiropractors that would follow them around. Like, certain stars had them, like, Stockton had them or Jordan had them, or, they had their chiropractor that would travel with them or be a part of their healing properties or healing process or optimization. And
mhm.
now that they saw such a benefit from those top athletes, remember they didn't get their big contracts up front.
Yeah.
They needed to stay in the game long term at 90%, like really being and functioning optimally. They needed to stay in there a long time to make all the money that they made. And in an era where, there wasn't as much flopping going on. Not nothing against that right now. But think about it, right? That's literally, and when you
Physicality was different.
yeah, and even you think about this professional athletes, versus that 14% of general population. That just is misinformation. People are being taught or told not to utilize chiropractic.
Mhm.
One, that it causes strokes, or two, that it could, kill people on a regular basis, or whatever, or harms people. Like it just doesn't happen. When you look at my malpractice insurance or our malpractice insurance, it's peanuts compared to what these medical malpractice insurance is really doing. So it's just missing that big idea, and hopefully we'll get some clarity to that today with what's going on.
And you said Stockton, he was getting adjusted 5 times
Yeah.
game day. Is that right?
Yeah, yeah. Pre shoot around, post shoot around, before game, middle of game, and end of game. Yeah.
And how long was his career?
Yeah, he lasted one of the longer ones, and he made a ton of money out of it because he stayed in the career. Plus, he was a short point guard who was getting beat up constantly out there. So, yeah, amazing.
We'll talk about a few athletes here in a sec that
Yeah.
utilize it and speak highly of it. And there's some of the athletes that have the longest or
Right.
have had the longest careers. And so yes, incorporating chiropractic into the organization now, it rounds out everything because we say it all the time in here. Like you have the MDs, the DOs, the medical staff who can prescribe the medication. Because yeah, it's if you're a professional athlete, you're putting your body through a lot, and they have all the medications and all the things to help you know take that down, but what are they then doing to
Rebuild.
optimize the
Yeah.
performance, really improve the function? And so you have the MDs, the PTs, the DCs, the nutritional coaching. Nutritional is spelled wrong. I apologize.
Oh,
Um,
there's all
and
that.
then the psychologists, right? Because psychology training too is so important. But that's where even the chiropractic can help with that, right? We talk about upregulation of the brain, um, and working even one side versus the other when we adjust patients as well. Chiropractic can help there too. So just we see the difference why professional athletes use chiropractic versus general population. We just need to do better um, as a society, right? To really understand, and that's why we obviously have these Zoom meetings to kind of show why we need to continue to have it. So. All right. So we've talked about a few things why, but obviously function first. We preach all the time in here that we're not here to just focus on your pain. We see so many people that come in not because they hurt, but because they want to function better. They already feel great, but they want to feel better leaving. And so when we focus just on one area, we miss so many other pieces of the puzzle that could be contributing. And so athletes, obviously, they're prioritizing ways to optimize and move more efficiently over just symptomatic relief. We said they have the medications to help with that. What are they doing to help upregulate the body and really optimize that performance? Maximizing their availability. If they are able to continue to perform well, right? One, they're going to play better, they're going to play longer, but they're also going to maximize their earning potential. So contracts are going to be extended. Um, they're going to make more money, and for them, they're playing at the highest level, so they're trying to earn as much as they can. Obviously, it's not a long career. They have maybe 5 to 10 years at the most before their bodies start to really take a toll, or right they just want to move on. Most of those athletes, they've been playing since they were able to walk, and so their body, they want to do something a little bit more gentle on their bodies, and so they're trying to maximize their earning potential in that time frame before they move on. And so,
Well, you think about that, right? The best athletes are going to make more money. So if you're stronger, faster, healthier, and functioning better, that gives you an opportunity to make more money. Oh, I got to get a plug.
yeah.
But keep talking though. Let me get a plug.
Oh, you're okay. And then obviously our nervous system dictates everything. So muscle recruitment, our coordination, our balance, our stability, our athletic output. And so they know that by getting adjusted, they're going to be able to help optimize it to its fullest potential. So let's talk a little bit kind of like how do they get better performance out of it? So reaction time and mental focus. Those are huge. If we're able to optimize that signal processing, we enhance that brain to muscle connection. The muscle's able to fire quicker. Even with the TBA that we utilize in here, we see it it happens instantly. If they're not able to lift one leg versus the other, putting a little bit of that stimulus in, upregulating the brain to then fire and send those signals to the muscle, and then
More
they're able to
efficiently.
lift it
Yeah.
right away. I don't know how you argue against that, but because you can see it in real time. So we're really optimizing that signal processing, but then the cognitive function as well. We talked a little bit just briefly about, the psychology behind it and the neurological component uh, of being able to, one, concentrate better, right? We upregulate the brain, and we have better clarity. So we have the parasympathetic and the sympathetic state. If we're always in that stress, sympathetic, you know, not
Well
allowing
said.
the body to rest and really process what's going on, we're going to break down. They're not going to perform as efficient as they would. So the chiropractic really can help bring us in back into that parasympathetic, allow us to gain a little bit more clarity, especially in those pressured situations. Game 7, balls in your hands. All right, what are you going to do? What's going to happen?
Yeah.
So, and then obviously the biomechanical and motor control. So, better coordination, better functional strength. Um, if we can get better muscle recruitment, better proprioceptive feedback. So proprioception is the brain's awareness of the body in space. We have to be able to understand where we're at. Or we talk about the golf swing. Um, for me, for TPI, all the time in here is you have to know where your body's at in space, where your hands are, what you're doing with the club. Um, and being able to stabilize in certain positions, you have better spatial awareness. So that proprioception is super, super important. And as well as that muscle activation. And so these athletes, they're throwing hundreds and hundreds of pounds around, and even football players having to go up against another 350 pound athlete. You got to have efficient recruitment of motor fibers and motor units to maximize that power output.
Yeah. And just safe from injury. I mean, seriously, yeah.
Yeah.
Yeah. That
Yep.
trauma is
And that's
definitely could break down.
that's right here, that systemic restoration, being able
Yeah.
to recover quicker, and your body's physiology to adapt to those stimuli. We have improved homeostasis. Homeostasis just being able to bring that body back to baseline, right? Regulating those inflammatory responses and getting that blood flow, that circulation. Improved circulation improves healing time. So if we're able to do that, we can also work on that stress response. Um, and they have some of the best nutritional coaches in the world working for their organizations. And so when you combine the chiropractic with that, you're able to lower those levels, promote that autonomic response time, and really you allow. Oh, hold on, I lost you guys. Oh,
You're good.
We're here.
can you see me?
Yeah. Yeah.
Hmm.
All right, hold on. There we go. Um, you allow for a better you allow the body to respond better to that stress response because it's physically taxing, right? That is physical stress. But not only is it physical stress, it's mental stress, it's emotional stress. You're constantly putting your body physically, chemically, emotionally through stress in that career. And so
Yeah,
we
just back that up a little bit, right, Sam? Is literally it's about energy, right?
yep.
If you're burning a ton of energy doing your performing and athletic performance, you still need to have energy to recover.
Hmm.
And so if you don't, that's that longevity of that recovery. If you keep burning that body and not giving it a chance to really regroup, that's where chiropractic can help with that facilitating, getting that out of that stress response back into that growth and repair. So then you end up, restoring quicker. So yeah,
Yep.
it's perfect.
So we'll dive deep into kind of some sport specific
Movements.
effects, movements here. Yep, absolutely. So we think of the golf swing, it's very rotational. So rotational mechanics really, really have to be um, prime. So the thoracic and the hip, I see all the time in here with TPI. Thoracic and hip mobility are two of the most common swing physical faults,
Yeah.
and chiropractic putting better movement into those joints, increasing that range of motion, increasing that better muscle recruitment to get you further into that backswing, allows also for more power and adding distance to your um,
To the golf swing, yeah, and that TBA I think is such a valuable tool that we use in our practice that gets them started because you can measure and see that functional improvement and then go what strengthen with
anything
that
around it.
PPI those exercises to help increase that range of motion and that function of those of that mobility. I
Yep.
think it's just yeah, it's so nice to see it put together.
And core stability is huge for the golf swing. Obviously, core stability is needed in any
All
sport, but the ability to control how much torque happens in the golf swing. Um, you have to be. We talked about that proprioceptive feedback. You have to know where your body's at in space, and so that's really really a huge component, part of the rotational mechanics there. For football, obviously, you've got nowadays the game has evolved into such a bigger and faster
yeah,
sport. 30, 40 years ago, you didn't have 350-pound lineman being able to run a sub 5 40-yard dash, and let
No.
alone put a helmet and pads and equipment on them. That's a so much force against each other that the body has to be able to handle that impact. And so um, being able to manage that joint integrity post contact, and enhance that muscle recovery, um, decreasing that tension, we can really, really help optimize that tissue repair. So those players, they have 5 to 7 days to really heal and be ready to go for that next game. So that's where chiropractic can come in. But for basketball too, plyometric power. Those athletes are jumping. They're jumping out the gym, and we talked about the game being more physical for basketball, 30, 40 years ago, but the explosiveness has completely flipped. The game is so much more explosive now. Um,
People are playing above the rim. I mean, it's just the way it is now. I mean,
Wait, are
there's
you
so much
saying
more.
it's more explosive now than when Jordan was playing?
oh
Well, I
yeah,
mean, just there's more people that are like Jordan now than there were when Jordan was playing. I mean,
yeah.
there are athletes now that are
And that's and
all
that's
big,
era that's
stronger,
era to
faster.
era.
Yeah,
That changes. Yeah. And
yeah,
and you look at big way to just tell is look at the dunk contest. You know, 20 years ago, I can't or 30 years ago, I can't remember when Jordan jumped from the free throw line, but that changed how explosive and powerful you had to be in order to jump from the free. Now you got people doing windmills, they got thrown off the backboard, they're jumping from the free throw line.
yeah.
And so you see just the plyometric and explosive difference for basketball players as well. They're just able to recruit, right? Those muscle fibers, enhancing that power output to improve their jumping abilities and verticality. So, and then baseball, right? I don't know if you've ever seen a freeze frame of a pitcher in his the back of his windup where that his wrist is pretty much below his elbow,
Yeah.
um, to create as much elasticity in order to rotate over, and get as much velocity out of the pitch as possible. So shoulder and scapular kinematics and mechanics are super important. Um, I worked for a professional baseball stadium in Michigan when I was in undergrad during the summers, and they had a chiropractor on staff that would always come in and check the pitchers before they play. So allowing them to help optimize their throwing motion, reduce risk of injury, Tommy John surgery, and the way that
Yeah.
that their pitchers are throwing now, they've definitely started, I think, regulate how many pitchers are being thrown. And if they see, potential risk of injury, they're getting pulled pretty much immediately now. So
Yeah, back in the day, those
so
guys,
they
those
also,
guys
just
would
like
pitch.
golfers, have to have.
Yeah, I was just saying, back in the day, those guys, Smoltz and all those guys, they would pitch, inning after inning after inning forever and ever, and
Oh
really
yeah.
have and not really keep track of it. Now
Yep.
they're keeping track because they really want to maintain and longevity of a pitcher's
hmm
career.
Well, and the season's so long. I mean, I can't remember how many games, but it's over. I think it's over 130 games now for
Yeah, I think it's
for
higher than
the
that. Yeah,
for the MLB season, and so you've got 5 or 6 games a week,
yeah,
with a day of travel in between. They have to be able to recover. And most of the time, if you've got a really, really good pitcher, that you want to have them for that next series. And so they're definitely doing what they can now to prevent any sort of injury risk. So research and evidence. I pulled a couple articles just on certain aspects that we just talked about to really kind of illustrate the impact of chiropractic. And so this is an article from the Journal of Manipulative and Physiological Therapeutics, that talked about how chiropractic improves our range of motion. And if you've been in our office, you've seen and felt it. We tell patients all the time that if you have a significant other or kids, um, for them to come in and them to sit in the seat to really see it change.
Yeah.
That really shows the value of it. But the journal said that spinal manipulation produces significant immediate increase in active cervical range of motion, supporting its role in improving joint mobility. So enhancing those joint mechanics can translate to more efficient movement patterns in dynamic sports. And so parents, we tell them all the time, if your kid's active in sports, bring them in, let them
Yeah.
feel the difference. We have uh, a lot of baseball players that are coming in right now, and their parents see it, but the kids feel it, and they say like, I want to come every week. The
Yeah.
parent understands that and sees that the change happening right there in real time. But when the kid feels it, they know, okay, like I want to function like this all the time. If this is going to help me play better, I want to feel this. So muscle recruitment and function, we've talked about it a little bit already, but adjustments increase muscle strength and enhance cortical drive in athletes, indicating improved neuromuscular recruitment and motor control. That's out of the European Journal of Applied Physiology. So better nerve muscle coordination obviously leads to a more rapid muscle firing and improved reaction times. And then pain modulation. We don't talk a ton about pain here in the office, but it can help. You
It
know,
works.
it
Yeah, it
works.
definitely does.
We see it happen in real time. The manipulation can significantly reduce it um, as compared to placebo, demonstrating a direct effect on pain modulation pathways. And Doc, you've talked a little bit about placebo, a little bit with some Instagram commentators. Um,
Right.
I was going to see if you want to talk a little bit
Yeah,
about
well,
origins
it's
of it.
just honestly, placebo's as effective, if not more effective, than even doing drugs. I mean,
Yeah.
some of the times. So it depends on what they're
Yep.
studying.
Yeah, they
But go ahead.
yeah.
Yeah, what they depends on what they're studying to find out whether
Nope.
or not
Yeah.
it's working. So they have to look at it to see
Yep.
where the pain is, what if it's headaches, if it's back pain, if it's shoulder pain, if it's some of those things, even with surgeries, right? They've done, fake surgeries or mock surgeries, and they found that they've actually seen that people recovered better that didn't have the surgery, had a mock surgery, than the ones who had a knee
Yep.
scope. So there's a lot of information out there of how powerful the brain really is with movement and understanding what's happening to the body.
Mhm.
Another thing too that we didn't mention, even with that muscle recruitment and function, right? There are some studies that show 15 to 30% of a
Oh yeah.
muscle improved recruitment after a spinal manipulation or a joint, mobilization or chiropractic adjustment. So there's a lot of research now coming out there that's talking more and more about it, which is why you're seeing other professionals try to swallow up
Mhm.
try to swallow up the chiropractic profession and put it into more of the medical model. So
Yep.
yeah, it's happening.
So I said we would talk about some athletes who are pro chiropractic. Um, and these are some of the best athletes of all time. Obviously, Tiger Woods 20 years ago, when he was at the top of his game, a little bit more trouble lately, but you
Yeah,
know,
but that trouble too is pain medications
yep.
that he has been on because he's had so many surgeries, so many things. This is
Mhm.
not a push for us to give more drugs and surgery, right? This is a push for us to understand that the dynamic of the movement patterns and getting adjusted. There's a place for chiropractic in all these professions that
Mhm.
sometimes when you have whoever's in your ear is telling you,
Yep.
chiropractic's not going to get you there, you've got to do this.
Mhm.
But these guys are working day in and day out to push their bodies to an extreme level that chiropractic, at some point, there's going to be wear and tear and breakdown. And
Yep.
this is where surgeries and things like that come in. And, these people still want to perform at a high level, then pain medication comes in. And Tiger knows. I mean, you can see his quote that obviously helped him with his swing, helped him with his game. Those are things that we know did what they do. And now you're not hearing him say, hey, you know what? I would recommend pain medication, right, Sam? That's where
Yep.
he's not going. He's talking about where he is now is he's in a predicament where pain now is the true battle. And maybe it's not chiropractically, you can't get through that window because there's been so many surgeries and so many things that he can't work through. And
Yeah.
that's why, still back in the day, like you were saying, he was definitely a huge proponent and supporter of getting that body adjusted and moving better. So,
Mhm.
But and then
Yeah.
you like look at Jordan. I mean, here you go. There's a great quote too from Michael Jordan.
Yeah.
You know, go ahead, Sam. Go ahead, you take over.
Well, I mean, even Michael Jordan being able to play baseball too, right?
Yeah,
He had a little bit of a, now they talk about Bo Jackson or Deion Sanders a little bit more for being that dual sport, because they were a little bit more successful in both of them. Uh,
yeah,
as compared to just one. But obviously, Michael Jordan being one of the greatest basketball players of all time, if not the best, that's up for debate. Uh,
yeah, sure.
but for Tiger and Michael and even Tom Brady. I mean, Tom Brady has had one of the longest. I think there's only one other. Was it Adam Vinatieri was maybe the one of the longest uh, football playing.
Quarterbacks. Well, Aaron Rodgers got to be up there too, right? I mean, but
Yeah,
his father
Aaron's
was a
Aaron's I think he's 41. Tom Brady, I think, retired. Travis would know
It
this.
was like 45, 46.
Yeah.
yeah.
So I think the only uh was it Adam Vinatieri that he
The
he
kicker.
yeah, he retired at 49, I think. Um, but
Yeah,
Tom Brady's been a big proponent and advocate for his longevity, reason being more the chiropractic and obviously just taking care of his health, right?
yeah.
The nutrition is such a huge part of it, and he's made sure to make that a huge priority of his career too. And then
And more toward the end, he really started paying attention to that nutrition more, right?
yep,
Obviously,
Mhm.
for the joint and inflammation and breakdown.
yep. And then obviously Usain Bolt. I like the quote. I liked his quote. I don't win gold medals, but when I do, I get adjusted first. Uh, So, and he's one of the most decorated Olympians of all time. So you see the support for it and the push for it. And so, we'd like those general population numbers to reflect
Increase.
obviously a little
Yeah.
bit more of the importance of chiropractic.
Yeah.
And so there's so many different techniques and so many different ways that chiropractic has been implemented in different offices, different practices, but the goal is the same, right? You put better motion into the body, into the joint, upregulating the brain, finding where that stress response or where there's stress on the nervous system, and being able to change it, right? So full body adjustments, like the TBA, that's why we love pushing it in here. We have a lot of people that come in and they're like, I've only been adjusted in the spine, and it's
Yeah.
nothing against those chiropractors, but there's so many other things that could be contributing, right? We talk about the knees being able to affect above and below, so the hips or the ankles or the knees affecting all the way up and through the low back. So optimizing joint mechanics in the whole body, adjusting those joints that may not be moving the way that they're supposed to, can really enhance that neural communication for peak performance. Now, we don't do a ton of soft tissue therapy, but we are trained in school, and I know a lot of chiropractors incorporate it for their athletes to help break up any adhesions or any muscular tension. They can really help
Well,
with. Go ahead.
well, I want to take back. I want to make sure we know we have Karen upstairs. It definitely does some soft tissue.
Exactly.
Yeah.
Absolutely.
We
So
use it for sure.
Karen's upstairs for
Yeah.
massage. And that's why professional athletes utilize the soft tissue therapy into their treatment, because they know it will also help support faster recovery. And
Yep.
then this is where, it goes more towards the physical therapist, but there are a lot of chiropractors that work on mobility, stability drills, and corrective strengthening. If you don't train the body now with the better movement that you've put in, you're not going to stay the same, but you're not going to be able to get to where you could be. And so improving the joint mobility and functional stability through dynamic movement pattern training can really, one, enhance the overall body awareness, but strengthen the body. I always used to say stronger things are harder to break. So if you don't strengthen it, it's not about if it's going to come back, whether it's pain, tension, or dysfunctional movement patterns. It's not about if it's going to come back, but when. And so a lot of chiropractic and rehab chiropractors now at the professional level incorporate all these while working with the other medical staff.
Yeah. And I want to back up with that. And I think too, when you talk about that, like all of that, it literally is the first and foundational thing, like you talked about, was that
Yep.
TVA. If you're getting the body moving better, everything you do after that adjustment is adapting to a better movement pattern that you just put in. So to
Yep.
me, when people walk out, they're like, well, what exercise? What do I do? What? Keep doing what you're doing. But now you're doing it at a different level with better movement. And so we still are like they're all incorporating it, but at that high level, they're definitely diving in deeper because they have these elite athletes that they're trying to figure out where those problems are stemming from. And that's why they're a little bit more honed in. But it's
Mhm.
always after the adjustment that we're going, we'll keep being active. We don't just ever go get adjusted and live in a bubble, right? We
Yeah.
always joke about that. You don't live in a bubble, you're constantly adapting. So if you're moving better, you're adapting better now to those movement patterns. So I just
Yeah.
want to, yeah, you can go to the next slide. I want to make sure we hit that. But
No, absolutely. And so less about the athlete here, but the business side of things, right? Professional organizations want the players that they draft, the players that they trade for. They need them to be healthy. One, because it increases, opportunity for championships. But um, they don't want to lose money. If they lose
yeah.
their players, they lose money. Then it comes back to the coaches, then it goes back to the owners, and then
Well,
you
think
know,
about it, right? You don't have your player out there. You don't make the money. You don't get the ticket sales. You don't win these championships. I'm sorry, but doggone it. It's all about what?
it's all about money at the end of the
Dang
day.
it at the end of the day. However, in our office, you still get a great deal on chiropractic, but you get to move better. And that's the biggest idea that you reap the benefit of the adjustment, not just, the idea of it's about big money. And I think that's one of the biggest things. Insurance is another game that we don't play either in our practice because of the fact that
Mhm.
it's so geared toward money and
Yeah.
proving a point that they have to use it or whatever. So,
Yep.
yeah.
And as an athlete, right, you don't want to be injured. We talked about that. But the money side of things, if your player is not playing and they're under contract, you're having to pay them,
Yeah.
right? You're paying them for not playing. Now you're paying for medical procedures, you're paying for the rehab. So there's a really, really impactful disruption in one, the
Organ.
organization, but two, the team's performance. So I know Golden State had a horrendous year for injuries, you know, and that impacted the whole team. I think they made it to the play-in game, if I'm not mistaken,
Yep.
but
Yep.
nobody on that team was healthy. They had um, you know, 8, 9, 10 guys on IR not being able to play. And so that's a lot of money that the organization is having to pay, um, essentially, that they're losing because they're not going to get, the results or the championships. That, Golden State is a great team, but
Yeah. If
yeah,
you can't get your players on the court, it's not going to
yeah,
get there. Same with businesses that run, these professionals. We talk about professional athletes. These same, all these professional buildings or professional offices that are out there. If you're not getting your people in working, or they're home sick because they can't work, that also affects their business. And this is
yep,
where healthcare, to me, is when they start focusing on the insurance. It's not a good model to follow. And
yep,
so you're starting to see people step out and learn a little bit more that it is about nutrition, it is about function, and we're seeing more and more of this happening. And I think it's a great move toward what's happening in our environment that people are starting to learn more and more and taking ownership of their health. And
yep,
chiropractic is a great way to do it. So,
yep. And talk about ownership of your health. We'll talk about this third point here. It's essentially, what's the max R, how can you maximize your ROI for you, but for an athlete, like, or an owner, right? You want to maximize your ROI. If you're going to spend X amount of dollars to get an athlete onto your team, you want to make sure he's going to be available and is going to have a long career with the team. So being able to have the staff and the trainers and the chiropractors, to make sure that they optimize their performance, that they stay healthy. You know, you're going to have the opportunity as an owner, as the team, to win to win some more games, to win potentially a championship. And so you know that if you can keep them healthy, you're going to get that ROI and hopefully maximize that player's potential. So the future. So chiropractic has definitely changed through the years, but I think the baseline of it has stayed the same. But at the professional level, you have these devices, this data-driven care where you can really look at the analytics. You can look at the data. You can test um, training, workouts. You can analyze all the data to for a treatment plan, for a recovery plan to really track the athlete's progress. They have these wearable devices for continuous monitoring. I think now that they have like under football pads, they have like
Yeah.
is that right, Trav?
Yeah. Sometimes in practice, we have our like athletes wear or our skill guys wear something that measures like speed output or distance covered during practice. So like you can kind of see kind of the output during practice, how much they've ran, how far they've ran, if speed decreases as kind of practice goes on, like things like that. It's kind of cool.
Pick a child to adjust that next day and see if it improves. Let's
Yeah.
go.
That's what I
Yeah.
was gonna say. I'd be interested to
The
see
hell.
like if you see an athlete starting to kind of like slow down, like mid-game, right? Halftime, like their numbers are down, they get adjusted and then they go back out, obviously with rest. But it'd be cool to kind of see if we could if they would be able to analyze that. Like this is what the chiropractic, this is what
Or
Yeah.
the power
may
output
be.
would be higher. Yeah, just
Yeah.
more. Yeah, yeah,
Mhm.
definitely.
And obviously the proactive aspect of it. People come in here, like I said, not because they hurt, but because they know they'll feel better leaving and they'll be able to go to the gym, have a better workout after getting adjusted. Or they've got a long day at work and they know, the adjustments can help them. So these preventative techniques help ensure consistent peak neuromusculoskeletal function for optimal, not just sport execution, but daily life execution.
Yeah, yeah.
So, your nervous system is your edge, right? We are not, some of us are not professional, most of us are not professional athletes. Dr. Bacon is, on Sunday nights. And, um, but, the athletes have to be able to maximize that reaction time, their power, their longevity, um, for that short career, like we talked about earlier. But for the everyday person, chiropractic is helping you reclaim your focus, manage your stress, boost your energy, move better, live better. There was a video, Travis, that Dr. Travis and I made back when we were interns, and it stuck with me the last 3 years being in practice. And we talked about, not being in pain in order to get adjusted. And then Dr. Travis would say, when you move well, you live well, and when you live well, you function well. And so putting better movement into the body incorporates all of that, right? Not just moving better to feel better, but moving better to reclaim your focus, to manage your stress, to boost your energy, to handle things at home, to handle things at work. You have to have the ability to do that cognitive clarity, the ability to manage your stress, even improve posture, right? Positionally or posturally. Um, we talk about it all the time in here. Above T6, we get internal rotation of the shoulders. Below T6, we get external rotation of the feet. And that's that stress response. If we're constantly in that fight or flight, we're going to be more in this position. And so chiropractic being able to pull us out of that into that more relaxed state, that parasympathetic, allows us to be a little bit more comfortable and can help with sleep. If we're not sleeping, we're not being able to repair, we're not being able to maintain some energy levels through the days. That's growth and repair. So the goal for athletes is one to train their nervous system to protect it and to optimize it. But it's not just for them, it's for us. So
Yeah, listen, I'm gonna end on this because I think is this the last slide.
that's it.
Yeah, so honestly,
Mhm.
I think this slide right here, what's really great about this that I take away is chiropractic is your edge for crying out loud. That's truly it. That is literally taking care of so many different things and moving you in a better direction that if you do it on a regular basis, you're always moving you and helping your body's nervous system deal with the stress response better and and adequately to
Yeah.
due to the stress response. It is your edge, man. I think that's awesome.
Well, people who wear the wearables and trackers and stuff, you should notice if you go and do a workout or a race or whatever, after you get adjusted, it should be easier to breathe. You probably have less risk of getting a muscle cramp. It
Mm.
should feel more natural. You shouldn't feel lopsided when you're running. Your heart rate might be lower. There are like a million different things. That you should be able to notice if you're paying attention to your data with your workouts and comparing to, oh, did I prepare well for this event, or did I come into this after traveling, after sitting for a long time, after being stressed out, not getting enough sleep? Think of all the little factors that can go into whether you have a good day or a bad day. And you don't have
Mhm.
to be a professional athlete to feel that. All of us have
Mhm.
our own sports that we still do, and hopefully we'll be doing it until we're 80.
Yep.
No?
Yeah. Honestly, Sam, I think you did a great job with this. I don't know if you could stop sharing the screen so that you can make everybody big again, but
Oh, can you see me?
yeah, yeah,
Yeah.
yeah.
Wait.
There you
Oh,
go.
there we
Yeah,
go.
perfect. So no,
I
listen.
was looking at everybody.
Yeah, no, it's perfect. So I think it was great. Honestly, the presentation is like I love all the information. There's so much to that. You almost got to go back through and read some of those slides just to kind of to really get the true benefit out of it because there's so much. But I think you nailed the biggest idea is really getting adjusted on a regular basis should optimize your true potential and allow your brain to communicate to the rest of the
Mhm.
tissue. There are, billions of cells in here, by the way, that are trying to function and they need help coordinating all of that function. And well, guess what that is? That's that central nervous system. It's no
Mhm.
longer, like I said, it's not pseudoscience. It literally works this way. And what are we doing to help upregulate it versus suppressing it? That's what, medicine does, very well. They suppress and try to get that communication to not really work as well. So I think it's awesome that we talked about it today. I think we hit the ball right out of the park. By the way, being sports. By the way, it's 162 games is what they're playing in the Major
Yeah.
League Baseball right now.
Yeah.
So I knew Travis was already researching that. I nailed
I
it.
was I was thinking it was 168, but
But
I was like, oh, that's too high.
no. But anyway, hey guys, fantastic. All the way, by the way, from Florida down here. I've got my Miramar Lakes golf course hat on here. That I just got to go play yesterday. Hanging out down here. We're going to be back in the office on Thursday, but we'll see you guys probably Thursday morning. We fly back tomorrow. I'm gonna have to pry Claire away from this place, but we are excited to get back and start working with you guys. So. Sam, thank you. We'll see you guys again in 2 weeks. We'll do another little Zoom call.
Yep.
I don't know who's going to lead it that day, but we'll figure it out. So, guys,
I'm gonna do it.
oh, we already have somebody raising their hand. So Claire is on. Claire is up for next Tuesday, or for two
Okay.
Tuesdays. All right. Well, all right, guys. Thank you very much. Appreciate you guys doing it. I'm going to end the recording really quick.